Welcome. Come with me. The doctors will see you now.
Hey viewers, welcome back to Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veer Vedala. Today, we're thrilled to have Dr. Jenna Geohagan join us on the podcast. Dr. Geohagan is a devoted family physician, mother of 3 young daughters, and a passionate champion in community health. Through her work at a federally qualified healthcare center, an FQHC, and the Impact Seminole initiative, she's making a profound difference in the lives of many. She practices outpatient family medicine at Central Oklahoma Family Medicine Center, also known as the Clinic, in Seminole, Oklahoma, where her commitment to patient care shines every day. Beyond her clinical work, Dr. Geohagan's dedication to service is truly inspiring. She recently organized a heartwarming Thanksgiving dinner that provided meals for over 300 people, exemplifying her deep commitment to giving back to her community. As an entrepreneur, she co-founded Drip Coffee Company, something I'm really excited to ask about, in Seminole, Oklahoma, delivering a fresh and convenient drive-through coffee experience under the fitting slogan, Community, Convenience, and Coffee. We're thrilled to explore Dr. Geohagan's journey in family medicine, her experiences with FQHCs, and the remarkable community initiatives she's organized. Let's dive in. Dr. Geohagan, thank you for being here.
Yes.
Thank you so much for having me. I'm excited.
Perfect. Well, I think I want to take this first question here, Dr. Geohagan. It seems like you know one of our podcast hosts really well. It's not me. So you graduated from the Great Plains residency program and even served as their chief resident. So you've had the opportunity to work with the Dr. Phil Palmer very closely. Can you share with us some of your experiences? How was that journey? Anything about Dr. Palmer you want to tell us? Some specific stories?
Oh, I would love to do that. So let's see. Dr. Palmer and I have known each other since 2012. So a good 12 years now.
Yep.
We first met as part of the Future Physicians for Oklahoma program.
That's right.
So I got to rotate after my first year of medical school, and it was really my first experience in this is the life of family medicine. And so I do have to say my favorite story is I was getting lunch one day in the Integris Baptist cafeteria. The service is not very good down there. So I noticed that I had a missed call from Dr. Palmer. And I said, oh my goodness, I better listen to this. So I pulled out my phone and listened, and it was Dr. Palmer very nonchalantly saying, hey, this mom we've been watching is ready to deliver, and we're going to let you do this one. And initially I was like, oh, no, this is no. But I was so excited after my initial shock, and we'd been in multiple deliveries, but I had most definitely never delivered a baby before myself. And it was the absolute best experience. That little girl is 12 now, and that summer solidified my desire to be a family physician. And so I always credit Dr. Palmer for that. There was a joke for a while at Great Plains about how outside of faculty, I had been there the longest time because I rotated after first year and then came back third year and fourth year, and then would occasionally pop in for lunch to make sure they didn't forget me.
That's right.
Yeah, Great Plains has the best lunches.
They do have fantastic lunches. Yes, they do.
Well, I get to share a story then on Dr.
Okay,
Geohagan,
of course.
since she got to do me. So my memory also relates to your time rotating at our clinic in the FPO program. Mm-hmm. And she was with me, and it was probably not the first day, but maybe the second or third day. And I had a patient come in who needed a knee injection. And so before we went into the room, I told Jenna, I said, I'm injecting both of her knees, so watch good on the first one because you're doing the second one.
You do the second one.
And her eyes got as big as saucers, and she's like, I can't do that. And I said, yeah, it's pretty straightforward. And so we talked about the anatomy and exactly what we were doing. And I said, and you're going to do it exactly like I do it. It's not going to be really hard at all. And I did tell her, if you don't want to, you can just kind of give me a little shake of the head no, but you're going to do fine. And so I, did my little patter with the patient and got the patient's consent to let Jenna do the second one. And everything was good, and I did mine. And I said, okay, well, we're going to get ready to do the second one. And I glanced over at Jenna, and she kind of gave me a little yes. And I said, well, we're going to go ahead and let Jenna do this one. And she did a great job with it.
She nailed it, huh?
I love that you remember that. I now do joint injections almost every single day. So I appreciate that so much.
Great. But the second piece to that, though, is that her face when I told her you're going to do this, that kind of shock, and that can't be possible. But then I remember seeing her as a third year doing joint injections on somebody and being the attending and coming in and supervising her. And not only was she entirely confident in the process, but she had a medical student in there that she was talking through the process of what she was going to do. So kind of seeing that come full circle in her growth as a physician is one of my favorite memories of residency training.
That's got to be such a proud moment for you.
Yeah, definitely.
And I still love having students to this day. So.
Yeah.
Well, good.
That's great.
Well, I learned from talking to you earlier that you are part of an FQHC, as Veer had mentioned. So tell us about that experience working in that type of a practice environment, and what are some of the challenges you've encountered there that you don't necessarily see in a corporate type practice, and what are some of the rewards that you get through that process?
Oh, yeah. So I originally did not work for an FQHC in Seminole, but the company that I work for is called the Clinic, Central Oklahoma Family Medical Center, and they were the first rural health clinic in Oklahoma. So they opened in 1968 and stayed in Kanawha for a long time. And then through the amazing leadership of our female CEO, her name's Brenda Ware, they started expanding. And so now we provide services in Ada, Stratford, Kanawha, and Seminole.
Okay.
And so when they started expanding, they reached out to us and started talking about the amazing benefits of an FQHC and what that can offer to a patient and enhance their health. And so for listeners that don't know, an FQHC is a comprehensive, mainly primary care-based clinic that has some federal funds, and the goal is to improve access to care, especially in medically underserved areas. And so it's one of those things that I didn't know very much about before I joined, and now it is honestly one of my favorite parts of the job is I can now treat patients not just with what they can afford, but optimal medical care. And so we have a very comprehensive setup. So unlike other FQHCs, we offer specialty care. So we have endocrinology, cardiology, podiatry, ENT, dentistry. When I forget some, I'm sure someone is going to tell me about it. We have OB-GYN. Yes, we do.
Consults.
Yes. So rural medicine has tons of unique challenges, but we mitigate a lot of those with the way that we're set up. And so one of the amazing things that we offer is we have a sliding scale. So if you don't have insurance, based on your income, the cost of your visit is cut down. And then we also have what's called a 340B pharmacy program, which was established in 1992. And its goal is we are able to purchase medications at an affordable rate, and then we pass on those savings to patients. And so the biggest reward that I've seen is patients actually getting the medications that they truly need. So one of my favorite stories is my previous company, I had tried to get a patient approved on Farxiga. So he had type 2 diabetes, has type 2 diabetes. He's still my patient. And also chronic kidney disease. And so for those of you that know, it is a perfect medication for both of those, and one of the only ones that offers treatment for both. Right. And so I wrote a very lengthy letter to get his insurance to approve it, and they did, but it was going to be $1,500 for a 90-day supply. Right. And that's just not affordable to anyone. Nope. And so after we switched to the clinic and we were able to use that 340B program, we were able to get it affordably. And he is still on Farxiga to this day, and his kidney function is fantastic. So I am very proud of that. Yeah. So it is just in my opinion, for rural medicine, an ideal way to really meet those healthcare gaps. And it makes me so happy to do my job every day.
Yeah. Now, is the clinic as an FQHC open to everyone in the Seminole area, or is it income?
It is.
kind of
So
thing?
so you have those additional benefits of the sliding scale if you are uninsured.
Okay.
But we take all insurances, we take Medicare, Medicaid, all of those things, commercial insurances. And so we do have, our priority, of course, is our immediate community. But we have people that drive from all over because they don't have insurance or they can't afford their medications, and they drive from all over to see us.
Excellent.
And are all your services in the building you work at, or is it like expanded?
So they're scattered. One of the ones that I didn't mention earlier is we have in-house behavioral health, which is a fantastic resource. So we have behavioral health on site there in Seminole, and then our other specialty services are scattered through Kanawha and Ada.
Okay.
Yeah.
Right. And then for my knowledge, how far away is it drive between these?
Oh, yeah. So Kanawha is about 25 minutes. Ada is 45.
Oh, yeah, it's not bad at all.
So it's not bad at all. Yeah.
you can eliminate that trip.
One big happy family.
Yeah, it's all connected. And in addition to that, there's a lot of healthcare disparities that occur in these rural settings. What are some strategies that FQHCs can help kind of mitigate that? You mentioned a few already. The specialized pharmacies, behavioral therapy on staff. Have you noticed any huge disparities in different types of patient population, or certain conditions that are specific to your community that the FQHC is helping with?
Yeah, so we have care coordinators that really help make sure our diabetic patients are getting the care that they need, that our COPD patients have all of their medications that they need. So we have a special program where you can have an emergency kit. And so if your provider approves it, you can have a steroid pack or azithromycin to treat a COPD exacerbation on hand at your house. And our care coordinators organize that in hopes to cut down on unnecessary ER visits and hospitalizations. So those are some of the programs that we do. We also cut down on the lack of health maintenance and cancer screenings. So we have an agreement with Cologuard, and so we can get our uninsured patients tested for free in most settings. And so it really allows us to close those gaps where if patients can't afford it or they have to pay out of pocket, they often just say, everything's probably fine, and move on. And this way we can say, hey, you're doing well and we're up to date on everything and everything is okay right now.
So along those lines, for breast cancer screening, is there a mammography center as a part of this FQHC, or do you guys partner with local hospitals to get that service provided?
Yeah, so we do have an agreement with Mercy Ada, so a lot of ours go there. We also have different kind of coupons for, I believe it's Project Woman, that goes through my lead nurse. So I just say, hey, Desiree, I need a mammogram for this person, and she makes it happen. Great. So that really helps me. But we do have special funding for that as well.
And then have you guys started looking at the option for cervical cancer screening of HPV only and patient-collected samples?
So I'm not really sure if we have explored that or not. So I'd be interested to ask my OB-GYN colleagues as well. So I'm not sure. We haven't had that conversation yet.
Yeah, that's something we've just started briefly discussing. Started discussing.
Okay.
We've started discussing
the conversation.
That as an option at the residency.
Read about that recently too, the self-cervical cancer screening center. They made a little initiative for GBS testing in pregnancy for self swabs before, and now they're like, oh yeah, HPV testing can have similar results. And
yeah.
So, I mean, it's fascinating.
Yeah.
Think about and see.
And
we haven't
honestly,
even discussed that at all in Norman Regional. So you guys are already starting that, huh?
No, we're just talking about
it.
Little talks about it, about whether we go
that would most definitely expand access to care too, because I have many women who are uncomfortable with a pelvic exam, especially if they've had previous trauma. So that would open doors a lot.
Yeah, and I think from the little bit of reading I've done on it, it's not a home collection. Although that may be done in some parts of the country, it's still having the patient come into the clinic and having an interaction, but the specimen's collected by the patient,
and not themselves.
By the doctor with the typical pelvic exam.
Okay. Yeah.
Well, Dr. Geohagan, we have a lot of providers here, and every provider has family physician has a different style of practice and how they have their day-to-days happen, right? So what does your typical day look like? Curious in an FQHC. How does that, what are your hours? What do you
Yeah. So my day starts at the gym at 5:15 to make sure that I am my best and I've released my endorphins for the day,
Right.
and that I have the energy to treat my patients. We do offer a typical 8 to 5 Monday through Friday. 8 to 5 Monday through Thursday, and then we're open 8 to noon on Friday. So the clinic, in addition to being an FQHC and making sure we're meeting our healthcare needs for our patients, they are very family and life friendly as well. So they have found that Friday afternoon off really benefits staff retention and happiness and all of those things. So it goes a really long way. But then my day-to-day is scheduled based on the complexity of patients. So I have some patients that I know need some extra TLC. Those appointments are longer, and we have the flexibility to do that.
That's awesome.
So, and then typical lunch, which I always work through and make sure my charting is done.
Yeah.
So, yes.
Admin burden.
That's exactly right. Yeah. Or I'm signing papers constantly. Yes.
Constantly.
Yes.
That's awesome. Do you guys have like a specific EMR specific to the FQHC, or is it
We use ECW, which
Okay.
was honestly, when we switched, one of my biggest hesitations because I was so used to Epic. My CEO would tell you I asked probably 1,000 questions about it before I agreed. But it's been great. So it's very user-friendly. We haven't had any problems with it. So,
we use ECW too, and they're
okay.
slowly incorporating the AI scribe. So I'm interested when that opens up. It's called Suno, I think.
Yes.
Yeah. So we'll see. Good things. But
What's AI? No.
We need to catch Dr. Palmer up a little bit there.
it's all included.
That's right. Well, Jenna, thanks for joining us. Viewers, we're going to take a break. Thank you for the opportunity to share what's going on in family medicine with you. And join us next time for more Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.